Want to just go over a couple of things that we have upcoming before we get into the forms conversation. So let's see, what do we have going on our upcoming schedule these next few days? Big thing going on this evening, but before we get to that, little bit of an election coming up, guys. So if you haven't thought about elections, Philadelphia is going to be a little bit different. There's polling places that have been closed due to the coronavirus. Voting by mail is an option. We'll have some information going out. Certainly PAR has been sending some stuff out. So not saying you need to vote by mail, but it is a viable option for you guys for this primary election. This evening, leadership secrets from the frontline women warriors. 7 o'clock tonight, we have a powerhouse lineup. Look at these folks, look at these women, look at that amount of experience of leadership and giving back to the industry as well as being consummate professionals. Our very own Heather Petrone-Shook will be leading that conversation this evening. Hope you guys can join us tonight, 7 o'clock. Tomorrow night, 7 o'clock, we're gonna have a special day, special time, virtual happy hour. We have a reason to raise a glass tomorrow evening, so hopefully you'll join us. It's a lot of fun, social activity. We've had lots of people from all across the city joining us on this over the last number of weeks, including PAR leadership. So, great opportunity to connect, have some fun, get some tips, and most likely probably make fun of me at some point in time during the course of the listening lounge being open. Next week, Tuesday, special day for Coffee Talk. We're going to have City Controller Rebecca Reinhardt with us, talking about city budget and things along those lines. It's a hot button issue. And a lot of things are in play as it relates to the city budget, as it relates to real estate. As we know, part of that proposal is increasing the real estate property tax. The controller has some thoughts on this and has maybe some nuanced opinions about what we can do going forward. So I think it'd be a great opportunity for you guys to find out right from her. As you know, you get the opportunity to field questions directly to our folks. So good opportunity. Hope to see you there on Tuesday. And boom, we get to this today. Standard forms. We're so lucky to have the chair and the vice chair of the committee that handles all this stuff on the state level. We have Christina Cardone and Heather Petrone-Shook. We are so grateful to have you guys here with us today to let us know about what we need to know for the forms and going forward. And we know that this stuff is going to be in flux. Things are changing. As we know, every single day is a new day and it's a new challenge and a new something. So anyway, the floor is yours. Thank you again for helping us out. We look forward to this.
We are so excited to be here. It's actually a great advantage here in Philadelphia to have the two of us on here because as we know, things are changing. So we're going to go over the forms today as they are written today, but we want everybody to understand that they could very well change very soon. So there will be updates. So please pay attention to GPAR and PAR's Facebook sites and the emails that you receive for any updates. There might be some minor tweaking because there have been some changes to the forms, but for right now, you're still good to use the forms as they are presented. And keep in mind, all of our forms, we like to think of them as living documents because they're constantly being updated as things change and go forward. So we really do appreciate all of that. We appreciate your feedback. So if anybody has any questions, we're going to go through the forms in order of the PAN form first, then we'll go over the HSA, and then we will go over the COVID addendum if we have some time at the end. We're going to field questions after each form is done, so that way you can, hopefully we've answered some of the questions or get to the questions for you and so forth. So we're really excited. I'm going to share my screen, so hoping this works. I don't know, Matt, if you have to give me permission.
How you making out, Heather? No?
Yeah, I'm trying to pull it up. Here we go. I should just be able to share this one. Everybody, can everybody see the PAN form that's in front of us? Let me know.
There it is.
Yes.
All
I
right.
see it. Mhm.
Perfect. So I'm just going to use my technology to blur it up here. So this is the PAN form. What does the PAN form mean? It's exactly what it says up top. It's a notice. And that's one key thing that you have to understand. This is a notice. And looking at the very first paragraph that we have, letter A says, while aspects of real estate can be conducted remotely, elements of transactions require limited in-person activity. We're still encouraging people to do what they need to do via Zoom, via communication electronically, still do your walkthrough videos, still have your clients do Google searches, do whatever they need to do to make sure they absolutely want to see the inside of the house. And at that point in time, then in-person connection should happen. So you have to attempt to do everything you possibly can virtually before you do in-person activities. Letter B talks about when you access properties in person, you have to be careful. I mean, we understand that there is a risk, and this form is to help you and your clients communicate. This is not the time to pretend like this doesn't exist and pretend or just assume that they understand the risks that they're, opening themselves up to. You have to have the conversation ahead of time. Conversation with landlords who have tenants who they should have the conversation with as well. You have tenants that if you're showing apartments to them. You also have buyers and sellers. So this form's intention is to have communication, to start the communication. Explain the risks that exist and explain the various steps that the Department of Health, the Centers for Disease Control, as well as the Department of State. So a lot of things such as the shoe booties and covers that we had to use and the gloves we had to use, which are changing, that came from the Department of State. The guidelines, certain guidelines came from the Department of State versus the CDC and the DOH. So under letter B, all parties should use their best efforts and judgment to minimize health risks, such as asking questions. So when we get underneath of C, and we talk about the Centers for Disease Control and the Department of Health, a lot of people have asked why, why is this in here? Why don't we have connections to it, etc.? Again, things change every single day. We're pointing out where they can go to find the information and where to look at the information, so that way they have the knowledge to go and do so. All right, because they're changing their rules and regulations as well. You are going to follow the guidelines. So all visitors will use hand sanitizer immediately entering the property. All visitors will follow applicable state and federal guidelines. Now, we talked about masks, gloves, and shoe covers, which I think I'm going to do a segment on what to do with your gloves and shoe covers, because I'm thinking in the future, maybe in 2025, the hand gloves could be used as balloons. I'm not sure. So we'll have to figure that out. But there are different things that are changing, and that's one of the things that will change most likely because of the guideline change. Access shall be by appointment only. As listing agents, you have control of your listings. You have the tools to make this happen, to stagger the appointments. You can go into showing time and block off time in between appointments so that people cannot make the appointments, therefore helping to control who's going in and going out. Hopefully that makes sense for everyone. You can also have the conversation with your sellers and have the real conversation with them. Are you okay with people coming in? Here are the guidelines. Are you going to sanitize the property? Are you expecting the agents to sanitize on their way out the door? Are we talking about notification, communication, etc. when it comes to this? We're also talking about staggering the appointments. And that's going to change in here. So the recommendation is 30-minute minimum. That's a recommendation for 30 minutes minimum. Could be 45, could be an hour. think about how big the property is when you're choosing with your client the time frame in between appointments. Is your client going to wipe down the house? Do they need time? What if your client says to you, you know what, this is really good. I didn't think about all of this stuff. Because they don't. They're just thinking about selling their house. Well, there are guidelines we have to follow. So what if they say, you know what, I don't want any more than 3 showings a day. So this is here to help you communicate with your clients. The number of visitors. So the number of visitors in the old way was 2. Now it is 3. So 3 visitors include an agent and 2 buyers. Please keep in mind, children are also humans and people. So when you're counting, you make sure you take that into consideration. As we're going through all of this, it's all about the communication. You want to have this communication and give this to the buyers and let them know, listen, these are rules that are out there for everyone. So if we're going to have to see this property, we're going to have to see this property in shifts. So this helps you to explain to them, you know, mom and dad might not be the ones to come right now. I might have to bring them back another time. Or if they do come, they're going to have to sit in the car and we're going to have to go in shifts and go from there. Somebody had asked me earlier about, well, what if, you know, the listing agent has to be present? Well, then the listing agent should communicate that to the showing agent ahead of time to say, hey, listen, I need to be present at all showings. So that way communication can be had as to who's going in and how you're going to go into the property. So that's always a good one. Obviously, property access should be limited to, you know, no more than 3 visitors. Again, you want to maintain the social distancing guidelines, which it's kind of interesting as you get out there and you start showing houses. You have to keep reminding yourself that you're not trying to avoid your clients, that it's just social distancing. So it takes a little bit to get used to. Doorknobs, lock boxes, and keys. Make sure you have sanitizer with you. You know, spray them, wipe them down, clean them. Do the best you possibly can. And obviously, if you see something, say something. Communication, again, with the listing agent is always key. And all visitors must comply with community association rules regarding access. This is actually really relevant in Philadelphia. When we're dealing with condominiums and co-ops in Philadelphia, you might want to contact the condo or the co-op board president or the board themselves and ask them what their guidelines are going to be. Maybe you show them this form to say, listen, we're giving this notification to everybody up front. You know, how can, you know, what else do you need from us? So again, circles right back to communication. Letter D states it right there that the seller could come up with additional regulations. So it leaves that open to the seller, property owner, landlord, etc., to have the communication to say, you know, I really would prefer if people wear gloves. And that's the right to say that. I would prefer if everybody would hand sanitize, you know, before they walk in the door. While, you know, I'll have a wash sink ready in the kitchen. I'll have this, I'll have that. But again, you want to have that communication. We have in our multiple listing service 4,000 characters underneath of agent remarks to use to be able to communicate to agents ahead of making the appointment what could be expected of them if you're going to make an appointment for this property. So use the tools and resources that we have. So number 2 goes to health and safety representations and lets them know you should provide each other with your current information. This has actually changed that all individuals need to share, and this could be verbally now. So verbal communication can happen now. Christina and I always like to use the phrase consult your broker, because that is something you definitely want to do. You might have a company policy that says, you know what, we really want everybody to put this in writing. You might have something that says differently. So this paragraph will most likely be altered a little bit to talk about the verbal communication possibility. And then there is also the HSA form that we have. The assumption of risk paragraph, there's going to be some minor tweaking in here to be, more specific to COVID-19. But it's just more so covering the risks of, hey, you understand this is not something we can see, we can feel, we can smell. So we don't know. So if something should happen, you understand that you took the risk by entering the property. Now, a lot of people are going to say, well, can't we be sued for this? Can't we be sued for that? I always say, if you don't wake up every morning and say I could be sued for anything, you're not starting your day off right. But that's just me personally, because you can. It's whether they win is a whole different story. But, there's also issues trying to track down where did they come from. However, we do have a responsibility, should our client come down with COVID-19, to alert. So that's something y'all should know. Below there is the signature line, and the signature line just has, seller, potential buyer, or the tenant, licensees who are going in, occupants. This is more so that you're all signing this saying, hey, here it is. I've given you notification, making you understand, and we've had a discussion. And that's pretty much the PAN form.
Can I prompt you with some questions, Heather?
You go right ahead. You're gonna test me.
All right.
I've had 4
Heather and
cups
I
of
will
coffee,
take
so.
turns, but I've been quiet a long time. I need to say something. So Heather, so at what point in working with a client, if you're about to have a new client or you have existing clients, at what point do you introduce this form?
So when this form first came out, I looked at it like the consumer notice, because it's a notice. So I looked at it just like the consumer notice, and I went back to all of my listings and all of my buyers and sent them this form to start the communication and dialogue. I have it in the file, so I have it. I've given it to them. We've talked about it. We've had communication. We've moved on from there. And I have now put this with my listing packet. Mm-hmm. So this is right off the bat. It's, hey, here's the consumer notice. By the way, here's the COVID form. Because we want to have this conversation in advance, not after something happens.
And so, and the same thing with buyers, right? Use it like a consumer notice, so it would go right up front.
Absolutely, everybody, buyers, and as well as tenants, landlords, as well as sellers.
And I know a question a lot of people have is, how many times are people going to sign this form?
Well, they should only sign this one in its current state. Right, in its current state, they should only really have to sign it once, unless something changes. And, if the form changes, we'll talk about, differences, but in its current state, it only should really need to be signed once.
Right, right. And I know another question a lot of people have, and this is along the same lines, there's no property address on this form.
Correct.
Because if we're hearing you, this is like the consumer notice. It's before you have a property. It's just universal to make sure that everybody knows this stuff to be aware of. Just like the consumer notice.
Absolutely. And that's the whole thing. It's a notification to start the dialogue and communication. Much like you sit down and say, this is the consumer notice. These are the various relationships you can have with a real estate agent in the Commonwealth. If we're in this situation, this is what it means to be a buyer agent, so on and so forth, dual agency, et cetera. This sits them down right up front and says, by the way, there's COVID-19. Let's talk about it right up front. How do you feel about people coming into the house? And you might have a seller say, whoa, I don't want anybody in here. That's a different conversation then. Or you might have a landlord that's like, yeah, sure, no big deal, no problem. You might want to take the next step and say, well, then let's give this form to your tenants, because there could be a completely different reaction.
Right. Yeah, so tenant occupied properties, that's going to be a challenge perhaps.
It very well could be. I mean, sometimes we run into, well, before COVID-19, we ran into, you can't show the unit until I tell you can show it, and so on. Well, now you have a third party involved in this that you should bring this up, have this, form, and, CYA, cover your assets.
Absolutely, right. So I know that we have some questions. Should I sort of monitor questions and pass them to you, or
I think
how do
Matt
you want
might
to do
be.
this?
Matt,
Matt?
is Matt,
You
are you?
need,
All right. I know one question I'll prompt you that I saw that is right on topic is, so what if the property's vacant? You still need this?
Absolutely. Because are you telling me that it has been, hyper sealed and nobody has ever set foot in the property, and that, the seller is never going to set foot in the property? Is the seller ever going to clean the house or go in and wipe? Who's going to do that? When I sat down with a couple of my sellers, the communication was, can you go in and open all of the closet doors? Can you go in and open up everything, that you possibly can open, so that way nobody touches a door? And that was the communication. And my seller and I have come up with a plan of when they're, every day after the appointments are over, they're going to go to the house and wipe down, doorknobs and things like that. So yes, vacant properties, this is a CYA policy. Cover your assets, have the discussion and communication.
Right. And it's like a consumer notice, vacant or not, everyone's got to be aware of the risks.
Correct.
Yeah, right.
hey, Heather, we have a grouping of questions here. I'm just going to kind of consolidate them,
Sure.
and it's relating to sanitizing and that kind of stuff. So gloves, masks, etc. Does buyer or prospect give tenant? I'm sorry, trying to figure out the question here.
I think there were questions about who has to provide them.
Who should provide the equipment?
Yeah, who should provide it? And then what do you do with it after it's been utilized? And then going forward into a rental property that's currently occupied, what kind of sanitizing stuff should happen in that respect if the owner isn't even local? So,
okay, well, let's talk about the protection. So when it comes to protection, and I can speak about what I'm prepared to do. I'm prepared that if my clients do not have it, that I will have it. If my seller requires it, I will make sure it's upfront and that the other agents know that it needs, this is the requirement to show this property. If you don't have it, you should communicate, again, back to the listing agent, have that conversation, because maybe the listing agent will say, listen, I'll leave a set, a box there for you, or, oh, there's a box of gloves there for you, etc. You never know. A lot of people, remember, this is all brand new. We have not done this before. So we're all learning as we go along. So if you have the equipment, offer it to your clients. Mm-hmm. I would just say you offer to your clients a disposal of it. I have a trash bag in my car that when I'm done showings, immediately everything goes in the trash bag. My clients take theirs home with them. I take my home with me, and I throw it out every time I'm done. So some people might be asking how you do it. I did have a client who fell within the very, very thin line of what we could show.
So along those lines, just a message from GPAR is this, dovetailing into what Heather just said. Folks, you may be a seasoned and veteran agent, but this is brand new stuff, and you need to be thoughtful and deliberative about everything that you do. The stakes are extremely high. We're talking about your personal safety and well-being. And maybe you don't care about your personal safety and well-being. I think you do. And you should care that level or even more for the clients that you serve. In addition to that, we don't want to do anything that jeopardizes us being open. The last thing we need is something that comes forth from, someone does a rogue open house type of a thing. We just can't afford that on a bunch of different levels. So the important thing here is to be overly cautious, read all the stuff that's coming down the pipeline. You talk with your peers and follow the protocols. We don't want to mess this up for a variety of different reasons.
So also to finish answering the question regarding the who's cleaning the property and when, again, this form should bring out the communication factor with your client. If they don't live in the area, you cannot tell me you do not know some cleaning service that you could offer recommendations, to your client to say, well, how about you contract with these people to clean down the property X amount of times, et cetera, sanitation, et cetera. That, again, goes back to communication with your client and who's going to do what.
And I said,
Go ahead, Christine.
oh, so I added or would add to this discussion, that we're used to following instructions from our clients. Historically, they've been easier instructions, right? Like, take off your shoes and turn off the lights and lock the door and don't let the cat out. Where this form has to prompt us to have discussions about instructions that are more complicated and specific, but we have to get those instructions from our clients. We have to make sure they have the information, establish the process, whatever they instruct us is necessary that they want for their property. And it has to cover things including the BP and including the cleaning and including how many showings. They will make those decisions with our help. And then as listing agents, you're responsible for conveying those instructions through the MLS or showing time to anybody who is going to come to the property. And then if you're a buyer agent, your responsibility under the Code of Ethics is to follow those instructions, and you only have access according to the instructions of the listing agent and seller. So it's all about communication, as Heather kept saying. It comes back to that over and over, but it's not a new obligation. It's just some new aspects to the same instructions we've always had to work with. Now we just have to talk about a few more things and convey those instructions clearly. And those instructions can include who supplies what and who does the cleaning and how. The guidance is that the sanitizing has to happen on entry and exit, and the guidance kind of gives us a minimum. It doesn't say who's going to do it, and it doesn't say you can't go further than that. That's what we have to discuss with our clients and then make sure it happens.
And also, so to finish out on the signature line section here, you have potential buyer / tenant. Some people have used that for tenants who are occupying the property now. Mm-hmm. That's really, the intention was occupant was who they are, but again, use it how you see fit. Just make sure it's clarity so everybody knows who it is. And the other thing is under service provider, same thing with service provider, and be careful that you might have a home inspector. You can give this to the home inspector and say here, but also you might want to follow up the home inspector and say, oh, and by the way, I also want this from every subcontractor that you're going to have come into the property. So that way we're all on the same page. So service provider could be, the photographer, could be the radon, could be termite, could be a roofer, could be a, general electrician, who knows? So again, communication.
I see a question about cleaning. And it is possible that some people will have the properties professionally cleaned at intervals that they agree to. But the guidance is setting a minimum, and the brand new guidance that we have from the governor says clearly that, the surfaces that are touched should be sanitized before the sellers come home or before the next showing. So that still leaves some flexibility about who does it and how exactly it's done and what qualifies as sanitizing. Refer back to the CDC and the Department of Health and figure out with the sellers what makes sense. Set the instructions, follow the instructions. Sanitize.
Right. As a buyer's agent, get yourself some cleaning supplies and bring them with you, so you have them ready.
So going into the chat real quick, yes, this is the way the forms are right now. Mm-hmm. They are going to be subject to change. If anyone didn't see it last night, Hank Lerner from PAR did a really good video that I would suggest going on the PAR's page and watch that video. It fits in well with this. It gives you kind of like where they're at right now and how things are going to roll out over the coming days. Keep in mind, the document was just released less than 24 hours ago. So, they have their team of attorneys picking through this and then seeing what the next steps are. And then Heather and Christina, they have their work cut out for them. So they're going to be, involved in this whole mix. So yes, but as it stands right now, these are the forms that are in play. So these are what we're using now until those next ones become available. So just keep an eye on any future communication from PAR. Right now is the time where realtors should be reading everything that comes their way. There's no excuse for this. What is it? Realtors don't read nonsense. You must read now. This is a time to read. Go ahead, Heather.
Yeah, I mean, full disclosure is we have a committee meeting on Thursday. So out of that, we'll, there will be tweaks because obviously the number of visitors need to be handled. So we know that there's going to be changes. So we're just giving you all the heads up in the 411 ahead of time. So keep your, ear out, your eyes peeled for communication.
Absolutely.
But for right now, since you're allowed to be let loose, at least you'd have some protection.
Yeah. Be cautious. And, I think this first form that we did, and I know the screen has already switched to the next one that I'll start talking about in a minute.
Do you see that? Because I can't see that on my side. So I was about to ask
yeah, the health and safety acknowledgement is up on the screen. But before we leave it, the property access notice, even if it changes, it will mostly be the same. And that is the most important principle. We've been taught over the years how important the consumer notice is. This property access notice is going to be with us a long time and is the concept we have to get most comfortable with, because as long as this virus is out there in the world, we're going to have to make sure that clients are informed, that we have these discussions about risks and processes. How much risk people feel and what the processes are, that is going to change over time. But as long as this virus is out there, this is something we have to be warning clients about, just like mold and lead paint and radon. These are things that we have to make sure every client is aware of now, and now add to that list COVID-19. So the most important thing to take away through the future business is make sure that every consumer you work with understands that notice and understands those risks before they go out into the real estate world and do something without realizing, or blame me for something later. If we are done with questions on that, we'll go on to the next one.
Any other questions on it?
The forms are live in zip forms and .loop and DocuSign now, and you can get them at PAR's website as well. And as soon as updates are made, within a few days, they will be, the new forms, if there are new forms, will be out to those vendors.
Yeah, so, and also keep in mind that the reason that they're labeled what they are is for easy access. So you can just type in COVID and it'll pop up.
Yep. Okay, I'll go on to the health and safety acknowledgement. Now, I get to be in the hot seat on this one. This is a form we know we're already getting feedback about. It's been in use for a couple weeks now in other parts of the state. We're just going to get to see it in action now. And before we even get to really come to terms with it, some of these processes may be changing. But let's get familiar with this form anyway, because again, the concept is not going to change, and the concept is really still very important. So this form is specific to a property, because this is the form that you have to make these health and safety acknowledgements before you enter any property in person. And if you are the occupant of a property and someone else is going to be allowed to enter it. This is what the governor's guidance in the CDC called, this is a health screening, okay? And, we know, businesses that are still operating are doing health screenings for employees. This idea of health screening is going to become very, very common, and you'll have to be pretty comfortable with. So here it is in our forms, in our transactions. Again, because the health screening is going to be necessary, we needed a tool to help us do that. Remember, all the forms are tools to help us and our clients comply with the guidelines. And to that end, as we have reminded people, they are not, mandatory. They're not required by law. Some of the guidance is like law. We have to do the things that the governor directs us that we have to do. And these are the tools to help us do that. And you also have to refer back to your broker, because your broker will may have specific requirements of what they need to control the risk for your company and for their agents. So always refer back to the broker. So the health safety acknowledgement, paragraph 1, does the same kind of introduction that we saw at the beginning of the property access notice. It reminds everybody, do everything remotely as much as you possibly can. But when a physical visit to the property is needed, then you have to have it by appointment. You have to keep in mind the guidance from the CDC and the Department of Health and the governor, and use your best efforts and judgments to follow that and to minimize risk. And then you have this under 1, A, B, and C, telling you how to use this form. If you're going to be answering these health questions, each individual person has to answer them for themselves. You can't sign somebody else's answers. So a separate acknowledgement has to be completed by each seller or owner or occupant of a property, however many people that is. Each of them needs to answer these questions before they're going to let anybody else into the property. And each visitor to the property, whether that is buyers or prospective tenants or other service providers, including inspectors and photographers, anybody who's in the property and anybody who's going to come into the property. Each individual person needs to answer their own questions, and you can't sign somebody else's. And these questions are time sensitive. So you can't answer them once and assume they are true forever. You have to be able to answer them within 24 hours before your visit to the property or before you allow someone into the property. Otherwise, they don't make sense. If you say you haven't had a fever in the last 72 hours, but you get a fever tomorrow, the answers aren't true anymore. You'd have to give an updated acknowledgement. The only time more than one person can sign this form, there are 2 signature lines at the bottom. If you have 2 people who live in the same household, typically like a husband and wife, and if their answers are the same, then they can sign together. Most of the questions are about households. We've gotten used to that. That's how a lot of this language around COVID and a lot of the preventative measures work by household, because you can't avoid sharing with people in your household. So if there are 2 people who live together and have the same answers, they could sign. Otherwise, each individual licensee, each individual consumer, seller, occupant, buyer, tenant, inspector, photographer, everybody. Paragraph 2, here are the questions. These are the health and safety acknowledgements. This is the health screening in paragraph 2. And, the essence of this is not going to change. These are questions about risk factors and COVID symptoms that we're all getting familiar with. They come from the CDC. They come from the, from the Department of Health. They're all over every news media. They vary a bit, but we should all be getting very used to a series of questions like this that identify the risk factors and symptoms of COVID-19. So each individual has to answer honestly and timely within 24 hours before the visit. If in the past 14 days the signer or member of signer's household has been diagnosed with COVID-19, if the signer or member of signer's household has knowingly been in contact with the person who's diagnosed or in the process of being tested in the past 14 days, as the signer or member of the household traveled to any place that is a risk factor, domestic or cruise or internationally. And then in the past 72 hours, have you had a fever or experienced symptoms such as coughing or shortness of breath? Okay. And to anticipate some of the questions, we're not taking people's temperatures. We're not even asking people to show us their thermometer and say they did it that morning. We're just asking them to answer a question. Have you had a fever? And we have to be able to rely on their answer. Okay. Then the next key part under 2B is that the person signing gets to explain any yes answers. And this is very important because we can't be discriminatory, and we know that it is up to the owner of the property in the end who's allowed to enter their property and not. They decide if they take risks. So if someone has answered yes to any of these questions, perhaps because they are a frontline worker, a nurse, an EMT, or perhaps they answered to some symptoms because they have asthma or allergies or something else, they get to explain. And then C reminds everybody that any yes answers and explanations, that yes, access to the property could be denied. Also, on the flip side of that, the visitor to the property could decide they don't want to visit if the occupant of the property has answered yes to some of these questions. So access to the property could be denied. It is always up to the individuals, and it's not up to the agents, it's up to the consumers. And they can still refuse or opt out of in-person activity. Just because we are all allowed to do it now doesn't mean people have to. So it is up to them. And they will decide based on this information. So this is a very important part of the process, that we make sure the consumers are informed so they can make informed decisions. But it is their decision. And the other important thing to remember here, as we are considering explanations for yes answers, and we are considering people making decisions about access with their own best judgment, we as professionals know we have to avoid discrimination, and we have to make sure our clients do not discriminate. So as you're picking and choosing possibly who's allowed in your house, and you get to see their names and maybe learn some things about them with this form, you have to be applying the same standards to absolutely everybody. You cannot, you cannot make an exception for one person and then not make that exception for somebody else. You cannot apply a strict rule to somebody and not to somebody else. So for instance, if a seller allows a nurse or other frontline worker to see the property, even though they disclose that they may have had contact with somebody in the hospital, they have the right to do that. But then the next time a nurse wants to see the property and answers the same question, they have to allow that nurse as well. They can't allow one and not the other. And if they are saying, absolutely no to anybody who answers yes to any of these questions with no excuses, then they have to apply that to everybody. So the same way you apply fairly, if you say all buyers have to have a pre-qualification before you see a house, then it has to apply to every single buyer, not picking and choosing. The same thing here. If you say everybody has to have all the right answers on their health acknowledgement, you must apply that fairly and equally, and make sure that your sellers do as well. That should
Christina,
be part
could
of,
I interject for a real quick second? So folks, inside the chat,
there's a lot of chat.
that is not the space where you should probably be offering medical advice. That is not the purpose of that. And we have some folks who are giving their thoughts and impressions on things. You could be 100% accurate, but I don't think that that's where we want that to get in there. It can cause confusion, misdirection, and that's the last thing we want to have here. Let's limit it to questions. Okay, because I'm seeing some responses to things and people kind of saying, this is what my thought is on that. That's not supposed to be what's going on there. It's not an opinion piece there. All right, guys. So let's just limit it to the questions to the two people that we have presenting here today. Thank you.
Thanks, Matt. This can be a controversial and sensitive topic, but yes, try to stick to the limits of the form and of our expertise. So, so be careful not to discriminate, but these are important. It's still important information to allow people to make an informed decision. The rest of the form should be fairly self-explanatory. The signer has to identify their role, same way they did on the property access notice, because this form could be used by any number of individuals who are occupants or visitors to a property. And if they're a visitor, we want to know the reason and the date and time of their visit, because this is a timely form and it needs to be done within 24 hours before that visit. And probably only one person is going to sign, but occasionally two people who share a household. Now, let's talk a little bit about, I know a lot of the questions are about this form in practice. So some of our practice may be changing since yesterday. The thing I know everybody heard the governor, everybody probably read in the governor's guidelines, it's the one thing a lot of people read, is that this health screening must be done prior to any visit and that it may be verbal. So hold your horses on any of in that excitement. Remember, we still have to make sure the guidelines are clear. A health screening has to take place before every in-person visit. So we have a tool to do that. This tool may still exist, even though verbal is possible. A written tool may still be very desirable, and your brokers should be consulted. Brokers may still want this to be in writing. Sellers may still insist that this be in writing and not just verbal. Also, another very key part of the governor's guidance from yesterday is that the real estate professionals allowing these in-person activities are going to be responsible to keep track of the names and contact information of anybody visiting properties. This is a bit of a burden on us. It's not, you know, contact tracing is not part of our expertise as realtors, but the governor is saying to us, if this is going to happen, contact tracing may be necessary. So you have to keep the contacts. So again, a written record may be required either by your broker to comply with that directive, or not. We will see. But whether you do that with this form, this tool, or something else, is there is still some flexibility there, but you do have to keep information. If you remember back to the property access notice that Heather described earlier, it said there under paragraph 2 that you should use this health and safety acknowledgement or a similar form to do this health screening. So there are some companies that have their own, and if the broker says that they still require their own form instead of this one, then that would be what you do. A similar form can do the job. The last thing I think to say about this form is about acknowledgement. And I know the acknowledgement of receipt box at the bottom of the form has been giving people a lot of problems. And I want to help you deal with that. You do not have to use this box at the bottom of the form. The acknowledgement of receipt, again, it was there as part of making this an efficient tool, because if our clients are making informed decisions and we know we have to follow our clients' directions, then maybe we needed a tool to make sure in writing that the seller read these answers, read the explanations of any yes answers, and agreed that the showing could continue. And maybe we needed a tool for buyers to say, yes, I read the answers from the seller and I still want to see this property. So we definitely needed, for our sake as professionals and to comply with the, with the guidance of the CDC and the governor. We had to make sure that we could show we're giving this information and that the parties involved agreed to go ahead. So whether you use this acknowledgement of receipt at the bottom of the form, you can. It may be useful. You send it to a seller and you have their electronic signatures to say they received it. Or maybe you send this form and you have an email back from the sellers. Yes, I read the form from buyer John Smith and I read his answers. He can go ahead and see my property. So an email acknowledgement might be satisfactory. But again, what satisfies the requirement may be up to your broker. So consult your broker about practice and just make sure that you are informing clients, that your clients are making the decision, and that you are following their decisions. Now, you could also imagine that for a vacant property, I know that's a question that's going to come up. And for a vacant property, the owner, who's rarely going to visit the property, they're probably going to be there sometimes, but maybe they're going to be there once a week. They should still do the health screening. And the one time they sign it could be good for as long as until they visit the next time. And then they would have to do it again. But as long as those answers are current and they haven't visited the property again, then that one form might be enough. Also for that property, potentially, that seller from the beginning could give you directions that said, I'm not there at the property, so as long as you make sure you get this health acknowledgement from everybody and all the answers are no, you don't have to consult me. I am telling you now in writing that I pre-agree to that all those people who just answered no to these questions can go, and that you only have to consult them about exceptions. So you could make the process a little more efficient if you have good communication and have good direction from your clients in advance. But otherwise, you are going to have to answer these questions, each individual for every visit within 24 hours. And you are going to want to make sure that you have review and acknowledgement, whether that is on this form or another form, whether that is in writing or potentially verbal. You have to make sure you satisfy your broker's requirements. You have to make sure you satisfy the governor's requirements by keeping contact information of anybody who's visiting and by making sure the health screening happens.
So again, these forms are alive. They, keep your eye out for any changes. You can quickly look them up by typing in COVID. All right. So I'm trying to see what other questions we have. A couple other questions. I mean, if a seller allows one nurse to see the property, I mean, I would say any first responder or anybody who's been in contact with COVID, let's just put it that way, to see the property, but changes their mind about another and declines, how does that work out? So I'm not quite sure if they mean like declines the appointment. So if we can get some clarity on that one. But Christina, what if a seller allows somebody in who is a first responder that has been in contact, or somebody has been in contact with COVID? Then what? You're on mute, Christina.
Sorry about that. You are going, you're going to have to be sensitive to avoiding discrimination. So it's not impossible to imagine that a seller might accept one person's risk because their explanation made it seem okay, and another person with a similar risk but not quite the same, and the seller may have good reason for accepting one and denying another. That again is where having good documentation and a paper trail to show that you did your job of informing people and the consumer decided based on really good information, hopefully you'd be okay. And that might be would be not inconsistent. Because everybody needs to answer these questions within 24 hours before any visit happens. If if you imagine a situation where the seller is allowing people in, maybe even to a vacant house. So the seller is a little bit more laid back because they're not concerned about themselves. They still need to be concerned about the safety of their property and everybody else coming into it. And they still need to make these representations current as much, as the guidelines say, within 24 hours. So if a visitor to a property answers all these questions, know that they have no exposure, but the very next day after the showing, they suddenly come down with COVID and they're diagnosed, well, contact tracing is going to come into effect. They're going to have to, they have the obligation, and their agent, if they know, would have the obligation to inform everybody. If that buyer had visited 5 houses the day before, they're going to have to tell those 5 sellers. And then those 5 sellers are going to have to answer the questions on this HSA before the next visit to their property. And they may no longer be able to say no, that they've had exposure to somebody who's diagnosed. Now they will have to say yes. And so that is how the form works, constantly by being updated and current. It should make sure that contact with people who are at risk or are diagnosed will be disclosed. And that is why your buyers need to be thinking about this as well as your sellers. A buyer who decides to go out and see 50 homes needs to think, oh my goodness, the risk. I'm going to go into this home and then this home and then this home, and how many other people were there before me, and how much risk is that? And do I accept that when I go forward out into the marketplace? That's what the property access notice helps, making sure they've considered the risk and accepted it. And the health screening gives them a tool to decide case by case.
So, I mean, we have a couple questions. I mean, one, it's in reference to under construction properties, and talks about the workers going in and out and how do we protect our sellers, buyers, and workers properly. Again, you've got to do the best you possibly can with communication, back and forth and et cetera. I mean, do the best you possibly can to CYA, cover your assets, and do the best you can.
And that's where health screening is really, I mean, this isn't just about real estate. Health screening is happening, across all industries that are in business.
So I just want to point out, because we're getting a couple questions where people are saying, is this for agents? Is this for tenants? If you look right in the middle section right here that I pulled up, it actually outlines buyer, tenant, licensee, seller, owner, occupant, service provider. So they are all listed on here. So.
And agents have to sign this as well. If an agent is visiting the property with their clients, or a listing agent has been to the property, then you also have to fill out this health and safety acknowledgement. Yeah. Or at least do it, even if it's verbal.
And I mean, this is going to be a learning lesson. You might have a client who is a first responder. You might have a client who has had COVID. This is something that, it's going to happen. And that's why you need the PAN form to start the conversation and dialogue, and go forth. I mean, these are questions that we have to ask everybody. And you might have had COVID or been in contact with COVID. It's going to depend on, has it been the last 14 days, et cetera. So again, things could keep evolving. I mean, the governor just let us out, yesterday. So, who knows what's going to come out or come full circle or anything like that. So we're just going to have to keep our eye open, and it's a learning curve. It's a learning curve.
Focus on the information so that people can make informed decisions. One of the reasons for these processes and the reason we have the tools is there is a lot of fear and uncertainty out there. If we can document that we've given all the information and the consumer has acknowledged that and they've made an informed decision, that process, just having that system in place protects us all, as well as we use it. See, obviously, if you opt to not follow guidelines, then you have much less protection if something goes wrong. You may lose protection from insurance and E&O coverages as well, as anything else. So the The guidelines and the processes help protect us.
But we don't know just yet. We're still
Right.
learning. So
Yeah.
Trying to think if we have any other questions that we haven't gotten to. If not, we'll do a real quick recap on the COVID addendum. So I'm going to stop sharing, and so I'm going to open up the COVID addendum, because I don't know how many people have been using the COVID addendum, which has been nice, but everything's getting lost on my computer here. Forms, they're everywhere, Christina. They're everywhere. All right. Yay, COVID addendum to the agreement of sale. Woo! All right, ladies and gentlemen, this form is a panic button. All right. And what I mean by that is you do not have to use this form if you do not wish to use this form. This form could be used in an emergency just in case situation. You absolutely 100% can utilize the change in terms addendum, the CTA form. If you haven't looked at the CTA form recently, the CTA form is now 2 pages. The reason for the 2 pages is to extend timelines. This is a panic button situation. It does not have to be 30 days. Seller and buyer can negotiate for a shorter time period. This form is also much, when it comes to, who gets to enforce the button, both parties sign off on the top saying we agree to the above terms. What happens below the line is either party can push the panic button, and it does not require the other side's signature. So much like the termination, because the hotline gets questions about the termination form constantly, you only need one side when you go to this part of the addendum, where it is who invokes the right to hit the panic button. So it's only one side. It's the notifying party who hits the panic button that says we need the extension as it relates to above. So you can, again, we go back to communication. Go back to communication with the listing agent and say, listen, we're, the floodgates have opened, and now we can't find a home inspector who can't, or the home inspector we found can only do it in 15 days from now. So have communication with the seller and the agent ahead of time, and possibly use the CTA to change the deadlines. Because Christina, I'll let you take this one. What happens if you hit the panic button, Christina, and we're just going to use 30 days because that's what's on the document in front of us. What happens to all the deadlines, Christina, in the contract if the panic button is hit and the addendum goes into effect?
Right. So the way the addendum works, this panic button extends every deadline that has not already passed by 30 days. So if you hit the panic button 2 days after executing a contract, then every single deadline and timeline is still in play. Inspections, title, mortgage application, everything, including settlement, extends by 30 days. Not 30 days from the date you sign it, 30 days added to the dates or timelines that were already in the contract. So if your inspection time period was 10 days from execution, now it becomes 40 days from execution. If your settlement was May 25th, now it becomes June 25th, okay? Every single deadline automatically extends by that number of days. That applies to the deadlines that have not already passed. So right now, things are opening up, we have a little more control. You get your inspection done. Maybe you also, you get through the mortgage application and appraisal. So you've got most of the obligations, deadlines, and timelines being met now. But suppose something still happens to delay settlement, somebody being diagnosed with the virus, or some other business or government stoppage that's still in effect that prevents settlement from happening on time. The party who is delayed can still hit this panic button and extend settlement, if that's the only thing left, by 30 days. So any timelines that are still in the future, move 30 days or however many days you put there. You know, now our use of this form may change a little bit now that we have more control and we can do more things in the real estate transaction, predictably. Legally and legally. So now, you know, 30 days might not seem as important. Maybe people are going to start using this form with, you know, 15 days in there. It's negotiable and it's a tool. So from the outset, you have to get a buyer and seller to agree to it. And sometimes the seller doesn't like the idea. They might not agree to it, but hopefully they will. If they don't, remember you have other tools like the change in terms addendum. But this is a good, because it covers a lot of things that we can't control. So you probably still need it in some form. And I think the other thing, Heather, I don't know if you were going to say it, but you can only use this once, right? You can't keep extending.
It's one and done. I mean, that's what line, you know,
Right.
line 14 said.
Yeah.
One
Once.
Extension. That's why this is the panic button. You can't pull the parachute cord twice.
Exactly. Good analogy. Yeah. You do it once, one party, whoever gets delayed at whatever point they are delayed, they give notice by using the bottom of the form. They enact that extension that was pre-agreed above, and they get that much time. If you find that you need more time beyond that, you can still extend. You can renegotiate any terms of the contract at any time and use the appropriate forms like the CTA to do that. And as long as everybody agrees, you can continue extending or changing other terms if you need to.
And that's the CTA comes in great handy. You know, please, you know, agents, if you have not seen the CTA, the change in terms form, please go to Zip Forms. All of these forms are on Zip Forms and .loop and in your forms library and available at parealtors.org. You need your NERDS number to log in if it's your first time. Make sure you have your NRDS number, which comes from NAR. If you're a GPAR member, you don't have it, please email Donna at gpar.org and, you know, ask her politely for it. You have this extension as a panic button just in case. I know we had some questions about
We have a question about termination that
go ahead, go for it.
So, because we had this question a lot, and it's very important to understand how the form works. So this form does not give you some new and different right to terminate a contract. It gives you the same rights you have in the agreement of sale, the same contingencies that we are used to, and we know exactly how they work. All it does is extend the timelines. So if a buyer is looking for the ability to terminate a contract, we know they have that choice in the home inspection contingency. If you've extended the home inspection contingency by 30 days, well, now you have 40 days or more to make those choices, including potentially terminate the contract. That's how the contract already works. We know it. We're just extending timelines. It's simple. It's safe. We know how that goes. You don't get some new right to terminate. So if you've extended settlement by 30 days because of some delay that happened earlier in the contract, and then, you know, 2 weeks before settlement, the buyer is diagnosed with COVID-19, if that means settlement can't happen, you may have grounds for an extension if you haven't already used it, that is, because you can only use it once. So sorry to be, you know, if I'm confusing you, you can only use this once. But if they're diagnosed with COVID-19 and that causes a delay, then this may work, but it doesn't give them a new right to terminate. So if they recover from COVID-19 and settlement can still happen, they don't get the right to terminate. They don't have a new and different right to terminate that they didn't already have in the contract.
And we're also going to say consult your broker, have a conversation with them, and, you know, in-house legal counsel, etc., to make sure you're CYA. So one of the other things I was trying to, when it comes to the change in terms addendum, if you have not read it, please read it, because I know a lot of agents out there take out the blank addendum to extend settlement date, to change the mortgage amount, the mortgage names, you know, all sorts of fun stuff. You don't have to do that. and pretend practicing like an attorney, the change in terms addendum actually has all that stuff written in there, including if you need an extension on what used to be the mortgage commitment, which is now the acceptance letter section. That's all on this, on the change in terms addendum. So, which is good. Yeah, I mean, this, you know, we're trying the best we can to deal with the situations that we have. Please understand that, you know, between PAR and the Forms Committee, we have consulted with other states. We have consulted with other associations to try and bring the best we possibly can to the situation we have by learning from what they've used. There are some forms out there that are way more intense than the ones we have, you know, and then there are some that are less intense, but we didn't feel covered our members enough. So a lot of people keep bringing up HIPAA. You know, again, it has not, we're not there. It went through legal. Legal has, you know, 7 ways from Sunday. I can't tell you how many lawyers have touched this form, but please also circle back to your brokerage and what your broker is going to require you to use, if at all. So again, communication. This is a whole new day today, and it's these forms. We're just letting you know there's a very good chance that they will change soon. Possibly.
I saw a question that is easy to answer quickly. Someone said, does e-showings meet the requirement of keeping a list of visitors to the property? Unfortunately, I think not. The governor's guidelines say names and contact information of the visitors. So having the name of a showing agent is not sufficient. You need names and contact information of visitors. This is, however, one of the things we're waiting on a little bit of additional guidance from PAR, because it's a new obligation on us, and they're trying to make sure they give us the right plan to protect us. But that's what the governor says right now.
And there's one question about, do you have to show evidence of condition that triggers the automatic deadline extension? The form at the bottom, the way it talks is that here's the reason why we're extending it, but we went back and forth on that, and it was more along the lines of, you know, calling somebody liar, liar, pants on fire was not where we wanted to go with this. That all parties had previously agreed should something come up that you had already agreed. So we left it at just, I'm extending because, and here's my reason, and I'm invoking my right to hit the panic button. So a short answer would be no.
Yeah. And there's another question I can answer easily that, you know, if you had a buyer who made an offer without physically visiting a property and now they are allowed to visit the property, yay, do they have the right to terminate? Well, you know, if they have that right in the original contract, for instance, in the inspection contingency, that is the most obvious one, if that inspection contingency was also extended and is still in effect, then the buyer has the right to terminate under the inspection contingency. If that inspection contingency has passed, they may not have another clause in the agreement that gives them a right to terminate. Or maybe they do. Condo and HOA docs.
Well, but beside that fact, I mean, condo and HOA docs, they're pretty simple. If you don't have them, you can terminate. But what you all need to also understand is just because Governor Wolf opened the gates, these condo and HOA, well, the condo associations and co-op associations could still be on lockdown.
This is true. So
utilizing the CTA and communication with the listing agent as to what's going on, you know, can we get in? Can we get an extension? Can we do so? It's all about communication. We're trying to make this through, and you know, just because Governor Wolf said you can go out and show properties does not mean that the HOA, you know, condo association, co-op is going to let you in the front doors.
And sellers too. You still do need seller permission. So, you know, just because the governor said it's okay to do in-person activity when absolutely necessary doesn't mean that that 80-year-old seller who's protecting themselves has to let 10 people into their property. You're still going to have to communicate and work through this. And that, again, that's where, you know, the notice and the health acknowledgement come in, because people have to understand the risks and have full information to make decisions.
So we hope that this was, you know, extremely helpful. But you know, we're constantly collecting information. So, you know, in the chat, Christina and I will give our email addresses.
Okay.
Please do not spam us. All right. But what we're looking for is we do take your feedback seriously. And we do have a meeting with the Standard Forms Committee on Thursday. So we're looking for feedback on these forms so that way we can take it to, you know, the committee and say, okay, this is working, this is not working. You know, this is a comment that we received, you know, how can we make this better for our people? You know, is there something that we can tweak? Now, you can also keep these on file for the remainder of the year, because this would also go for all of the forms that we touch.
Yeah.
But preferably right now, we'd like to focus on the COVID forms. And if you could do us a favor, and if you have a specific question about a certain line number, please note the line number so we're focusing and not looking through the document trying to figure out what you're looking for or trying to figure out what you were trying to say. Also make sure that you put, you know, COVID paperwork or COVID, something COVID in the subject line, standard forms, COVID, so we know that we've got what we've got going on. So we've had a good time today. We really appreciate GPAR.
All right,
Yeah.
Christina.
Happy to have the opportunity to help people through all this new stuff. And yeah, changing all the time. But
Constantly.
the principles are the same. So keep your eye out, but also, you know, be informed and let people make informed decisions, and you'll be in good shape.
Solid stuff.
Good, guys.
Thank you. Thanks, Julie.
Thank you all. So this evening, 7 o'clock, Women Warriors, hope to see you there. Christina, we'd love to see you there too. It should be a pretty good.
Sounds like a fabulous program.
Yeah, it should be awesome. So thank you both for all of your thoughtfulness that you share with us today, the experience that you bring to the table, and for everything you do for us up at PAR. Some of that stuff is makes your brain hurt, but sometimes the stuff that makes your brain hurt, it hurts for a reason, and it's usually a good reason. So thank you very much to all of you for tuning in today. We hope to see you this evening. Take care and have a great day. Bye.
Thanks,
Stay
everybody.
safe, everyone.
Bye-bye.